Anyway, sorry about that. Thank you, Paul. I appreciate that. We're recording now. Tell me it's in record mode, Paul.
Yeah, it is.
Okay, very good. All right, inflammation. What does inflammation have to do with anything as far as the brain? Well, there's a lot. And interestingly enough, there was, oh gosh, I think it was Time or National Geographic, one of the two, put out a piece on the shelves. You can look at it at Barnes and Noble about inflammation. And there were a couple of areas there that talked about inflammation in the brain. As we know, inflammation is necessary for, for our immune system to work. When there's a cut, or we get stung by a bee, for instance, or we have redness or swelling after surgery in an area where there's an incision. That's inflammation, and that's necessary to bring about healing. So we're going to look a little bit about when inflammation attacks the neurosystem, the brain. What are some of the mechanisms involved? And how does that look? What's going on actually on a maybe microscopic level? And then how do we treat inflammation? And how is it treated as far as the brain goes? And then what do we do to prevent inflammation? Especially inflammation that's chronic. I think we all think about acute inflammation. I was aiming for a nail and I hit my thumb. Ow! That's going to be red, sore, maybe a blood blister. You're going to get some inflammatory response, and you immediately take something perhaps, or put ice on it, or heaven forbid, you didn't break a bone at the end of your thumb, which might complicate things. But inflammation is going on. That's what's going on when that happens. So we need it. So here's some of the basics of it. Let's say you have a cut, or you have an abrasion, some kind of wound, or a bite. Your immune system goes to work right away. And I realize that this is not very big enough to at least read, but what you have going on as you're looking at it, be on your right side, just like it is on my right side here. You have pathogens, in this case, coming in from the outside, right? Now, immediately, a whole bunch of mechanisms, or I should say, a whole bunch of workers go to work right away, and that are things like platelets, especially if it's an open wound, because you want to stanch the bleeding. Hopefully, your system's working normally at this point. You have mast cells, and that's responsible for things like swelling at the site, and blood vessels opening up a little bit or becoming wider. There's neutrophils, those are white cells. You have macrophages, and those have different mechanisms for taking care of bacteria or invaders that come in necessarily when there's a wound. And interestingly enough, macrophages release these other little parts called cytokines parts. Cytokines is also, when it's working well, is a natural part of the inflammatory process. What's happening with all of this here on the right side of the page is natural. You can see there's an invader coming in, there's a cut or a wound, and your immune system goes to work right away. And so that's normal state of affairs, normal state of what happens in inflammation. And it has to happen in order for a wound to heal, or in order for whatever is going on. It might be an incision, it might be a broken bone, it might be something else. Your immune system goes into overdrive. not overdrive, but it goes into drive, pardon me. So how we doing? Can you hear that, Paul?
Yeah,
Okay. So this is just very, very much covering the surface of the topic. But I just want you to understand that you need inflammation. We need it without the inflammatory process. Without inflammation, we wouldn't exist. Knowing the number of things that happen to us as human beings, it would go bad for us very early on. So we need inflammation. So here's what it looks like. You know, you have pain. Maybe you have warmth or heat at the site. You know, maybe redness, some swelling. Let's say if it's an elbow, you get loss of function also. So pain, swelling, change of temperature. In other cases, if we're talking about maybe a viral or a bacterial infection, you might have a fever, possible, on top of some of these other signs and symptoms. But what if your infection has something to do with something that's on the arm? You'll still have the inclusion of a fever, most likely. You get increasing blood counts of your immune cells and platelets, like I showed on the last slide. So this is just, again, very basic look at inflammation and some of the signs, and everybody has experienced this at one time or another. I'm assuming we're all human here, so. Okay. Any questions so far?
Where does it go wrong?
Ah, okay, I'm getting to that.
Okay. Keep your participants coming.
Oh, good God, I forgot. Tom? Tom just asked the question, it's a good one. Where does it go wrong, or how can it go wrong? Because we need inflammation in order to heal. It's a normal process. So when can it go wrong? So let's take a quick look at what's acute and what's chronic, because there's a difference. We're looking at what we just looked at is kind of the acute phase of inflammation. Maybe it's an allergic response. I've been stung by bees and wasps. Trust me, I know about that allergic response. Takes a while for that to go down, pain, but you get swelling. I've been stung so many places, but you get swelling, it's painful. You might have an allergic response. Thank goodness I had nothing more than local. Some people are very allergic to bee venom or wasp venom. So that's when it gets a little more dangerous. But let's just say on the acute phase, you have maybe a traumatic injury, maybe a burn, a cut or a wound, maybe it's frostbite. But this is, we're looking at the acute phase of inflammation or acute cases of inflammation. Where it starts to go bad is when we look at chronic inflammation and what's usually associated with it. And we're usually looking at things like arthritis, rheumatoid arthritis, for instance, other autoimmune diseases where I want to say your immune system begins attacking you, healthy tissue. That's where there's a bit of an overdrive. There's so many conditions that we face that are likely autoimmune. Parkinson's is an autoimmune type condition. So is, of course, rheumatoid arthritis. That's autoimmune. Let's see. Certain forms of bowel disease are also autoimmune as well. Let's see. Those are just a few I can think of right off the top of my head. But yeah, MS. Yes, myasthenia gravis too. Yes, absolutely. Thanks for thanks for plucking that out of thin air for me. I appreciate that, but yeah, absolutely. Because we're going to look at some of that as it applies to brain tissue, because it's we're going to be looking at the glial cells and what's going on with them. So if you just get an idea from this, we're talking about a lot of syndromes and cancers on the right side of the page. And we're talking about acute cases like a burn or trauma or a cut, maybe even an infection on the left side for acute inflammation. Because normally we're speaking of acute inflammation as something that's going to resolve and is, in a timely manner. Chronic, different story altogether. So how does this relate to our brains, especially the aging brain? Well, as we get older, we start to experience some cognitive impairment. Some of it's natural, some of it's maybe related to some other condition that you have or something you have been through in the past, like maybe multiple, I want to say, CVAs, strokes, other vascular injury to the brain could cause some cognitive impairment, damage to neurons. And again, we're talking about, and we're getting to it, some of those neuronal diseases mentioned just earlier. What was your name again?
John.
And so John mentioned myasthenia gravis and multiple sclerosis. Yes, two very good examples of autoimmune diseases or conditions that affect the brain. Okay, so there's damage to neurons, damage to brain tissue. There's the aging process that brings about a little bit of shrinkage in the brain. There's genetic impacts. Maybe there's things you inherited that start to play a part. Damage to the vascular system, and maybe that's due to other problems that you're having too. Maybe you have heart disease, but maybe it's a process you've lived a long time. Maybe you have coronary artery disease, some peripheral vascular disease that eventually is going to make its way to your brain and cause problems up there with narrowing of blood vessels and perhaps eventually a stroke. Neurotransmitters, that's a pretty interesting situation too, because over time, how those neurotransmitters are, should I say, used or picked up by our brain changes a little bit. We don't produce as much, or the receptor sites are not as active to pick up a neurotransmitter as it was when we were younger. Same thing goes with hormones. And then ability to deal with free radicals, our body's ability to simply neutralize those things. It tends to be less effective as we age, sometimes without any other things abnormal going on. So again, here's some more of these injuries. This is probably a better picture because it covers a lot of those other disorders. Asthma causes a lot of inflammatory processes to happen in the lungs and respiratory system. Diabetes, also autoimmune, colitis, Crohn's. That's what I was trying to think of. Of course, psoriasis. Boy, if we don't hear enough about psoriasis on the television and medications to treat that, I don't know what we hear about. Different cancers, cardiovascular disease, joint disease. If you have a history of joint disease in the family, especially rheumatoid arthritis, and there's a chance you might end up having to deal with that sooner or later as you age. I know my mother had it, my grandmother and grandfather both had it. So I'm just waiting. I'm just waiting. Um, so those are just some, just a sample of the different conditions that bring on inflammation. So I don't know, part of this inflammation is a term called inflammaging. I don't know if any of you have heard of that. Also part of the aging process and how inflammation works in us as we get older. Apparently, the aging process actually contributes to inflammation, or at least the progression of it. And if you already have some sort of chronic inflammatory disease, you will be dealing with low levels of inflammation as you get older. Again, rheumatoid arthritis is one of those. Diabetes is another one of those. So our immune response, if it's constantly lit up, instead of responding when it should to an acute situation, that's where things begin to go wrong. And so I want to say too, that's where we come up with. That's where systemic inflammatory response syndrome comes into play. And that is the overreaction of the immune system. And that could be to viruses. It could be to bacterial infections. Certain cancers could bring it about, especially if you have more than one of these things at play. The immune system is going to go into overdrive. But this is an extreme response. It's not like everybody who comes in is going to have SIRS, but it's common enough that we see it in the hospital, at least often enough to recognize it as a potential problem. So what we're looking at here on our person on the right, you have instabilities in our DNA. And our aging process, how we age, is dependent on things like cell division, and hopefully nothing goes wrong with that. However, things have been known to go wrong with us as we get older, and that normal process is interrupted. Stem cell exhaustion, oh God, okay. Yes, I would have to break that down. Sorry, somebody else immunosenescence. Oh, I can't say that. Yeah. Try saying that 10 times, huh? So senescence. Well, immunosenescence, they should put a hyphen there. Yeah. Because the senescence part is something I'm going to talk about in a minute. Wish they had put a hyphen there. It would have made more sense. So you've probably heard of anything that has an itis is going to be an inflammatory condition. Encephalitis, meningitis, myelitis. Probably heard of all of these before. So encephalitis really has to do with brain tissue is being affected. Meningitis are the coverings of our brains. The meninges, which have 3 layers, I'll just leave it at that, but they're the coverings that protect the brain. And myelitis has to do with the spinal cord and going, down our spinal column to the peripheral nervous system. So, again, it seems as if you're older or if you're much younger, you're at greater risk of these 3 conditions. And these three conditions can lead to an over response of your immune system too. I mean, yes, we can treat all three of these. We have the means to do that in the hospitals. It's, some of the signs and symptoms we see going with these would be, acute confusion, fever, I want to say immune system response, headache, nausea, vomiting. These are all things that we expect to find, including metabolic findings due to infection, reports in the labs, electrolyte imbalances, white count. Again, some of these might actually lead to seizures, trouble speaking, responding appropriately to commands, etc. So lots of signs and symptoms associated with these three conditions. But these are a good example of different attacks on the nervous system. Questions?
It's not a question, but trying to get a handle on this. It seems like inflammation by itself happens either acutely if you cut yourself or something, or an external. You could have cancer, you could have some other thing that could cause an inflammatory response.
It could be environmental.
And so that inflammation by itself is not bad, but when you have it being caused by an external or something else in your body, that it's chronic and it's there all the time, that's when it's damaging.
Yes, absolutely. I want to say there are environmental conditions too. You might be exposed to certain, I don't know, either something in the air, something in the food or the water, something in the soil over and over and over again. That would be, those would be cases of an external source of inflammation, maybe even chronic, especially when you don't know what's the source of this and it keeps happening all the time. And I've lived here forever and ever and ever. Or, well, yeah, you just happen to live downstream from a plant that dumps, chemicals into the water, and your water comes directly from this river, or smokes comes out of industrial plants, and you just happen to live downwind of all of that, and it's constant. That could change a lot of things inside your body. So there's an environmental process also at work. At least there's a possibility of that.
What about nutritional allergies?
Yes, that's a good. I'm glad you brought that up. Oh, for Christ's sake, I can't remember your name. Karen.
Karen.
Oh, okay. Sorry about that. So Karen brought up food allergies. And yes, well, there's more than just one food allergy. There's allergies to gluten. There's allergies to milk products. At least those are a couple of examples. Peanut allergies. Of course, you would know right away if you had a reaction. However, I want to say sometimes you can be ingesting these things for a long time, and then all of a sudden you break out and your windpipe starts to, it starts to swell up and constrict. It's like, well, what brought that on? I've been eating peanuts all my life. Yeah, probably the peanuts. Or what if it's a drug? What if it's a drug you've been taking for a while, and all of a sudden you have a response and you've ruled everything else out? Maybe it's penicillin, or maybe it's a sulfa drug or something like that. So yeah, hopefully that's just acute, but if you take the drug again, you're likely to have a similar response once your immune system, reacts like that. So that's a good point. Stuff you ingest. Let's see. Okay. Any other questions? Any additions?
Maybe not even allergies, but sensitivities to them.
Yes. And I would think too, with sensitivities, even if it doesn't, it wouldn't necessarily bring on an immune response, but it might cause other symptoms, that are unpleasant, especially in your gut. So, yeah, sensitivities should be recognized as well as, I mean, if you keep ignoring that, you might end up in a chronic state or worse. It's true. All right. So how does the brain figure in all of this? And how does dementia figure in all this? Well, okay. We have cells in the brain that actually work to, well, they are actually pro-inflammatory. We have astrocytes, microglia, platelets work up there too. They work at getting rid of intruders, whether that's just debris or maybe it is bacteria. And when they're functioning normally, it's great. What's worst case scenario is, developing a cancer of one of those cells, but these cells too have another way of going into hyperdrive. It has a lot to do with, I want to say, well, I'm getting to that. I'm putting the cart before the horse. We'll get to that in a second, but the whole process of chronic inflammation, we're thinking about how it affects other organs and maybe not paying too much attention to how it might be affecting the brain. I want to say too that if you have chronic problems with vasculature up in your brain, or I want to say you have a seizure disorder, or you've had many strokes, this system, this immune response can have also a very bad reaction and cause damage to the neurons. The neurons are the most fundamental cell of brain tissue, nervous tissue, so causing neuroinflammation. So what happens too, and I like the way this points down here and this little arrow to the box, because this simplifies things. You have neuroinflammation, and this might, I would say the arrow would go both ways for vascular damage. And in the end, that brings on cognitive changes. But what they're still studying, what they're finding out is this inflammation in the brain can lead to release potential risk of dementia. And even more so, as far as diets go. I'm glad you brought that up, Karen, because, diets, and we're going to talk a little bit about that here momentarily. Diets that are non-inflammatory versus the pro-inflammatory type diets. Ones that we know high in sugars, cholesterol, fats, etc., are pro-inflammatory diets. And if you already deal with an inflammatory condition, you're just adding fuel to the fire. And that's why, looking at these different anti-inflammatory diets, there's something to that. As far as, okay, well, at least if I'm being treated for this with other medications, etc., lifestyle changes, I can change my diet at the same time and help prevent any further damage, that might already exist. So it makes sense. So Alzheimer's. This is one, I think this is Brain Month, and it's Alzheimer's too. I think that's what they recognize in the month of June is Alzheimer's disease. Anyway, chronic inflammation. Inflammation in general, again, is great. It's the chronic that we're worried about. And what's happening is this is encouraging, this chronic inflammation is encouraging more tangles and beta amyloid plaques that are usually associated with Alzheimer's disease. So a study was done, and it's tied into this microglial activation and tau propagation in the study done in Nature Medicine. Inflammation is actually enhancing. You can have these tau tangles, in other words. You can have these plaques and not show any signs or symptoms of Alzheimer's dementia. That's the thing. And it's kind of like, wow, that's maddening. However, if you have some sort of inflammation going on, especially if it's chronic, what it's doing is it's encouraging the production of more of these tangles and this tau phenomenon, this tau propagation within the brain. And so, this is kind of a breakthrough as far as Alzheimer's disease goes, because we didn't know where this stuff was coming from. And there's a link now, at least this is one of the links that they've discovered as far as dementia goes. So it makes sense. It makes sense. Any questions?
Where are the tau? Where does tau come in?
So, what it's that, okay. So the tau is part of that tangle. And I want to say the beta amyloid plaques. And what it looks like, I wish I could find a good picture of that and what it looks like surrounding brain tissue and neurons itself, because it's a pretty nasty looking web-like tangle. And I don't know if any of you have ever seen a picture of that on Google or something like that, because you can find it if you go look. But I didn't find a clear slide that, showed that. But it's, and usually they're, now we have the technology to look for, areas of the brain that might be affected by this. It used to be that we had to wait until a person died and then open the brain up. Not necessarily anymore. So, yeah, I have kind of an interest in this because my mother died with Alzheimer's dementia. So that was on her death certificate. Yeah, and I could see it presenting years before she died. So it got worse and worse and worse. There's very little now. We still don't have much that we can use to treat it. If we can identify it early, that's key. If it can be identified early enough, and I want to say effective measures taken in everything from experimental treatments, because I know there are a lot of them out there. FDA hasn't approved a lot of them, but once they are approved, they can probably get used. But it would be looking at treatment as prevention rather than treating it once they already have it. And so that would directly come from lifestyle changes and what you eat, what you take in, what environment did you grow up in, genetic as well as epigenetic influences. You can't do a whole lot about what you inherited unless being aware. Usually being aware is enough. And if you're aware enough to look for it, you might be able to spot it early on and have something done about it. So, but yeah, as to treating Alzheimer's dementia and treating some of these processes, there's still a lot of research going on, but not a lot of breakthroughs yet. This is where the senescence comes in. Now, senescent cells are cells that no longer divide and aren't useful in a way. And actually, they do play a positive part as well as a negative part. So they play a role in the aging aspects of our brain. They play a role in tissue repair and healing, but they're also linked to a lot of age-related brain diseases and inflammation as well. So it kind of cuts both ways. And so these are what they call zombie cells, for lack of a better word for it. I like the term zombie cells. So they're dead, they're not dividing anymore, and they're not useful anymore, at least to a certain extent. They no longer divide, but they are hurting healthy tissue by bringing on inflammation. And that's where some of the research on this is going, especially with Alzheimer's disease. There was one study looking at this. I think it's a medication. So maybe it's the name of it here is, I wish I had written down what it was. Okay. This new drug, or I don't know if it's completely new, but they're trying it. You probably all heard of quercetin, at least some form of it, right? Well, this other drug called dasatinib is combined with that, and it appears to have a positive effect in neutralizing these senescent cells, at least in lab studies that were done, and effective in removing the cells and making inflammation less of a risk or less of a problem. So, this is one of the ways that they're looking at the future when it comes to treating Alzheimer's disease. But again, catching it early on is key. Even if you were going to use a drug approach, catching it earlier on is key to stopping a lot of the deterioration. Because before my mother was actually officially diagnosed with it, she'd actually had that condition for a good 10 years. And so, yeah. It just, then it was a matter of taking care of the rest of the body, which is which was what the aim and the goal was, for treatment after that. And, keeping her safe. Okay. Any questions? Yeah.
Let me make sure so, and this is before the stuff. Not the cells, like neutrophils aren't really changing, cytokines aren't changing. Is it?
Well,
Is the nervous system not telling you the right thing to do? The nervous system, if we could slow that down, maybe.
well, that's the thing. And that's the thing, because all your immunotissues that create these cells are also aging, including the ones up in the brain. They're aging as well, and they're not operating as efficiently as they used to, and that's why individuals, I want to say, who are older, elderly, are at greater risk if some inflammatory process is a slow burn. And I like the way my GI doctor put it with my gluten disorder. He says, it's likely you had this all your life. It was a slow burn, and this has just come to a head. And it's like, well, I'd never had these labs drawn before. I'd always had gut problems. I just figured it's the food, or I'll change this or change that. And never giving a thought to gluten, until about 6 years ago. And then it was a matter of elimination, which isn't easy to do. However, the effect it's had on my gut is widespread. I don't absorb vitamins very well anymore. Some of them, like B vitamins, I have to take sublingually. You know, because my gut doesn't absorb them. I don't have those undulation and absorption layers in the gut. A lot of that's been eroded away, and that's due to chronic inflammation. So, yeah, I mean, I always wondered why when a panel was drawn on my blood, why I had higher numbers of immature cells. It was like I didn't have an infection, but a whole bunch of these other immature white cells had high numbers. Doc didn't say, or said, don't worry about it. It's nothing. Well, I guess it turned out to be something. Anyway, so yes. And how I want to say if this process is a long-term process, and I want to say your body is in a slow inflammatory state, and something real comes on, like an infection or a virus, and you're constantly in this low inflammatory state, maybe without a fever or high blood counts, high white counts, and something real comes on, you could go into a very hyperdrive immune system that is, going to start attacking your cells or your organs. Could be in the brain, could be in the heart, could be in the kidneys, could be anywhere. But that's all it would take, usually. Again, I go back to that example of my gluten condition, and how all he had to do was order the right labs. And it was very obvious that my immune globulins for each one of those gluten areas or immune response areas were sky high, all of them, and I thought, man, this has been going on since I was a kid, not knowing one thing one way or another. So it hasn't led to anything dire. It's just that I don't absorb nutrients in a normal sort of way.
I got another.
Yeah.
So can you kind of train your central nervous system or the response? Here's the example. Suppose I really like eating ice cream, but I get brain. I just keep chowing down, and eventually my body will learn, hey, it's gonna happen. That's what being brain food.
Oh, I don't know if I would say that, but
Repeat it.
let's see. Well, if I heard you right, if you're eating something and you're experiencing this response, you figure, well, if I just continue doing this or eating this, won't my body respond normally to this over time? Did I hear that right?
That's basic.
Okay.
I can't train my body out of
No, I don't think so. I mean, I could be wrong about that, but I don't think so. Right. Well, yeah, you can train your cardiovascular system to a certain extent. Yeah, that's a modifiable thing. Absolutely. But when it comes to things like that, if you have a response and it happens every time you consume that, I don't think there's any way you can train your body, short of if you're lactose intolerant, you might, refer yourself to lactose-free this or that and see if that makes any difference. Most of the time it doesn't. If you have a lactose intolerance, it could be lactose-free and you'll still have an issue. But I think, if we're looking at this and I'm getting you right, don't think there's any way to train your system out of it. There is a way to see what particular things, since we're on the subject of food, are triggering this response. And you'd have to do that by several, there's a diet they call a FODMAP diet. And that's also one of those that is very selective. But you have to be selective in elimination diets too. And then you have to bring back those things that trigger it to see if that's actually what it was. So it's a long process, and I got to tell you, it's not an easy one. So how do we treat inflammation? Well, okay, in the short run, we can use steroids, glucocorticoids. We use them in cases of like asthma or inflammatory bowel conditions. There are, other states where we might use NSAIDs to treat inflammation. Some of them are selective for COX-1 or COX-2. It's just the type of inhibitor that is being addressed through things like Celebrex. You've probably heard of Celebrex. That's a COX-2 inhibitor. Mobic is another one. And then there are other antibody agents, biologics that have been used to treat inflammation, but most of these are in the acute phase because when you think about it, one way or another, they're dampening down the immune system. And so there's the other side of the issue here. You dampen down the immune system too much, you're susceptible to disease or illness. So you could use steroids for, exacerbations. However, long-term use of that is not a good idea. NSAIDs the same way. It's great for, conditions that are acute, but not for long-term. They have other side effects that you don't want to have, including, stomach bleeding. And I want to say, things that it does to your liver and your kidneys. And so these are for short run treatments of inflammation. And we oftentimes use them. We use them a lot. Now, yeah, I was talking to a friend of mine about holistic remedies and holistic agents the other day, and how she says, oh yeah, these are all good, these are all good anti-inflammatory, they fight those processes, provided you're not putting fuel on the fire as you're trying to put water on it too. Like adding gasoline to a fire. Oh, let's put some water on it. Well, I think that's counterproductive. So you have to make a change. You have to make a change in foods, and that includes additives, because we like to put stuff like salt and pepper, sugar, maybe, hopefully not too much of that, on foods, right? Well, some people will add pepper, like cayenne pepper has properties that are anti-inflammatory. Cinnamon, didn't think much about that, but yeah, it has anti-inflammatory properties to it. Turmeric, that's been known. I don't know how much studies have been done about that. Garlic too is another additive that fights. Ginger is another one that fights inflammation. All I want to say positive. I want to say they're not pro-inflammatory. They're anti-inflammatory. Home remedies. I mean, you can get this over the counter. You can add this to your diet. You can start making this a part of what you eat every day. Okay, more foods. I mean, I think you can guess on some of these what's maybe pro-inflammatory and what's anti-inflammatory. Which ones encourage inflammation, which ones don't, and actually fight against it. So some of this is an overlap of the last page, but it includes some other substances, whole grains, blueberries. And boy, that opens up a whole lot of other pages of, anti-inflammatory foods that you can make a part of your diet while you're either eliminating or you're limiting some of these other pro-inflammatory. Margarine, I used to like that one. Processed foods, yeah, anything out of a can or a box or anything that's been through processing or milling, and has been through a factory and has had things pulled away and then added back into it, you can pretty much guarantee that that's been thoroughly processed. Refined sugars, we all know about that one already. Refined sugars, not good. White flour has fewer nutrition properties than the whole wheat or whole grain flour. White rice versus the brown or the darker rices, etc. So I think you know where I'm going with this as far as controlling inflammation and things that you can do, especially if you're running out of ideas. We rely so much on them, we rely so much on science and medicine to come up with ideas for fighting some of these conditions, when perhaps we can look into other remedies or preventions that we can do because it's right there on the shelf at the supermarket, or you can buy it online or some other way of procuring it and take your own steps. Yeah.
I'm rather concerned because I keep seeing garlic up there as being something to protect you.
It keeps vampires away.
Yeah. But I'm finding that it's a major trigger of IBS. And
Yeah, I've heard that. Yes.
and I think to stay away from it, whether it's processed.
So there may be some particulars on this list that you can't tolerate.
And it's showing up in several of your different slides.
I know. And I think that this is in general considered anti-inflammatory versus the alternatives. However, I think if this triggers something in you and in others, and maybe not, at least in general, these are considered anti-inflammatory and not the other way around. However, there might be those, you're an individual who has a big sensitivity to this, and it's a trigger for, setting your guts off. So I think you have to, with foods, you just have to try them out. What historically has worked, what historically has not. What has triggered something in your, in your digestion in the wrong way versus, hey, this went over pretty well. I'm not having any, bloating, I want to say reflux, nausea, and trouble with either running at the bowels or being constipated. So this is where you really have to experiment, I think. Yes. Oh, yeah.
Just to finish off.
Oh,
by
sure.
saying That there's a marinara, RAO, R-A-O. They have different kinds of marinara, and one of them is no garlic nor onion. And it's sort of so it's a non.
All right. So it's considered,
It's
You
really
know,
nice.
yes. Okay.
Yeah.
Right. All right. So it's not going to, it still has, the same, I want to say taste for you, but it's lacking the garlic, of course, and the onions, but it goes over pretty well in your stomach and your intestines. So that's a big deal. You've been able to identify something in particular, and I don't know if all of us have been able to identify triggers like that.
And I've been lucky. I mean, I've learned how to read all the labels now, and anything that's got garlic in it, I tend to just. No, I will just avoid it.
I think that's a good idea. I have to be very careful with anything that looks like gluten, even though occasionally I I give in.
And when you're
Yeah.
sick, that,
Yes,
and that can mess up your immune system for like 6 months.
yes, it can. Yes, it can. I don't want to say I'm dependent on dicyclamine, but I've been on that drug for 6 years because invariably I can spot when my guts are overreacting because I want to say there's like a major fight going on in my guts and everything is moving around and it begins to hurt and et cetera, et cetera. And I, okay, what was in this that I ate that caused this to happen? Other than, it's an obvious, it's an obvious thing that you did. This has gluten in it, you ate it. Versus hidden gluten in some cases, which is a big deal because hidden gluten is also a factor. My gut doctor, GI doc said, yeah, it's the hidden gluten in foods, especially processed foods, that you have to worry about. If you read it and it doesn't have there's nothing obvious there, look at those ingredients closer and see how processed they are. Chances are they were either on machinery that had gluten exposure or part of the processing included gluten in some way that's not mentioned anywhere on the food label. So, yeah.
And my grandson at 13 months was identified, which was considered an unusual thing.
Wow.
They
That
didn't
is, I never heard of that.
they were to do there's that test they can do that would call for a colonoscopy. But my daughter had said, just the fact that I know I can take it away and it goes away. I don't need to do that, torture that poor, toddler.
Right.
Tom
Right.
had a question as well.
Oh, Tom, yes, I'm sorry.
But just looking at the bigger picture here, we're burrowing in on, specific things, but I guess what I've learned is that inflammation is not good. But there's no link so far that having inflammation in your body causes cognitive issues.
They think, well, the exception might be with Alzheimer's dementia, but the thing is, inflammation has been linked very clearly to coronary disease, I want to say peripheral vascular disease. You have a buildup of plaques inside those arteries, for instance, platelets, etc. The immune system goes to work and inflammation occurs in those blood vessels.
So which causes which? Is it the cardiovascular issue that you have that causes the inflammation, or is the inflammation making the cardiovascular?
Well, the inflammation is due to some of those processes going on inside your venous and arterial system after you've eaten in your, maybe there's, I want to say, if your diet is high in lipids, cholesterol, etc., some of that, because it processes through the blood system, gets deposited in blood vessels. And then I want to say it begins that swarming of the immune system, platelets and other white cells within your body coming to the rescue or coming to the response. It's automatic. It's automatic.
See, through this program, we've learned that diet and exercise, et cetera, et cetera.
Yes.
We're all following that regimen. But is that going to improve or not make a difference in our cognitive?
It's also vascular infection.
Yes. Yes. It's almost the same situation up in the brain as it is, around your blood vessels, closer to your heart and your lungs, where we're really worried about plaques breaking off, forming clots. Well, that kind of thing can happen up in the brain too. However, anything that narrows a blood vessel is going to decrease circulation into that area. And that includes moving oxygen and nutrients to and taking away metabolic byproducts that are waste. So the vascular dementia part is huge. And if this process is going on, again, it's a lot of time it shows up as a slow burn until something happens. And, you know, an infection could pull something like this off. Some other thing, a virus. I want to say something else happens. If you have a stroke or multiple strokes, that's going to definitely cause more inflammation as well, because that's involved in that process as far as, well, okay, how does your circulation deal with this, as far as, you know, rerouting, et cetera. Okay, those areas are dead now. As your circulation goes around those areas. However, if your circulation isn't good in collateral blood vessels, then I wanted to say, you know, this problem gets to become even greater. I want to say like expanding problem. Because if you have vascular problems here, likely you have them up here. Because those things don't just deposit in one spot, they're all over. You know, that's what causes, you know, problems with clots in the legs. And so I don't know if that,
I'm just trying to get a bigger picture. That's,
well, okay, and I see I think I see where you're going with this. What caused what? Where did it all begin?
that's.
Well,
Because, you know, the initial picture showed that the chronic was a lot of factors that can cause a chronic inflammation.
well, imagine this acute thing going on all over your body, day in and day out. Imagine that. Okay. Until something comes along. I mean, that in and of itself is unusual, but maybe you're creating the conditions within your own body that make inflammation possible. And especially over time. You know, I mentioned the example of my own gut. Eating these, you know, didn't know this was what was happening at all. Finding out, yeah, well, you have these erosions. We found out by looking at your intestines with a scope. And so this is the reason why you're having, you know, this is why your levels are up. You're having these responses, etc., and why you don't absorb vitamins very well. And you don't absorb other nutrients very well either. So, but how do you know all of this? How do you know? How do you know all of this is going on? Well, you can't do anything about the aging process except to be the very best you can be as you get older, right? When you're young, you don't think about getting older. As you're getting older, you think about it a lot, right? Habits established early on make a difference. They really do. So let's see.
It's a really comes down to no quick fix. Just
Well,
you do the best.
you know, there's prevention. I think prevention, an ounce of prevention equals a pound of cure. My mom used to say all the time. Yeah. Oh, I have a misspelling here. Other ways to reduce, I meant to separate those, by the way. I think to answer your question, Tom, it's, you know, it's a matter of prevention and treating as early as possible. You discover this is going on, and start taking steps as early as possible, or that this is something, you know, you've inherited, et cetera, and you know from early on, maybe you can take steps from early on to deal with this. A lot of it is lifestyle. but you can't eliminate necessarily everything. You know, environmental factors have an impact on inflammation. What you're exposed to throughout your life has a big impact on whether or not I want to say your immune system is acting properly or not. But yeah, yeah. Why does it always come back to you? Or you know, me, everybody in here. I suppose that's why I only tried smoking when I was a kid. I didn't take it up. I suppose that's why I limit alcohol consumption instead of taking that on as a hobby.
So you've got Epsom salt here on your picture. You're saying that you can actually flush out?
No, that's just dealing with local inflammation.
Okay,
Wouldn't that be great, though?
yeah, because I understand that Epsom salt will take out some of the toxins out of your body if you
I don't
soak
know
it.
about toxins, but you know, it is good if. All right, I used to use okay, you know, sitz baths to treat areas of local inflammation.
Right,
I used to have to do that. You know, and it was effective. It was effective taking a sitz bath. Epsom salts.
yeah,
They're effective for local inflammation. I can't speak to anything further than that.
okay.
I've heard of people soaking their feet in Epsom salts, and that seems to have a local effect too. But yeah, chronic systemic, I don't know. I
Yeah.
don't know about that.
Yeah.
I know that there are other things. I mean, you can't undo what you've done in the past, right? Can't undo damage that's already there. However, you can treat, you can change enough to manage what's, you know, so things don't get worse. And you don't induce this inflammatory process as often.
Yeah, I guess if you can pinpoint something that has triggered in you a response that causes inflammation, you get rid of it.
That's the thing. Yeah, that's the very thing. I think it's, for me, it's certain foods, and I haven't eliminated all of them yet. Yeah, it's it's not an easy answer. I think if you avoid certain things and you, I want to say, enhance certain things, exercise has been known to be a very good way of treating inflammation. A joint that's used or a body part that's used is going to stay active, mobile, and give you less of a problem than one that isn't used. So exercise is a big part of it. Stress is huge. Stress leads to the release of cortisol, and cortisol, while in the short run is great at, I want to say, for fight or flights situation. However, what if you stay in the fight or flight for a very long time? Is that good? Well, that's exactly it too. Stress itself, maybe you found a way to dampen it down, but you haven't found a way to control it, eliminate it in a chronic, from a chronic situation to an as needed, or hey, situational thing, but not beyond that. So, you know, switching up your diet, and I think this is addressing some of yours with the garlic. Switch it up. In other words, and I tend to be so one-dimensional, so it's hard for me. You know, oh yes, I can trust this food, I'll eat it over and over and over, instead of, well, what about this one? This one has the same type of properties. Variety. It's a good thing. Getting enough rest. Now, sleep is a time for your brain to clear out, literally. It's a time for your brain to reset. It's a time for, I want to say, not just reset, but to for the cells in the brain that are responsible for clearing out debris, including bacteria and other dead cells, it's a time, rest is a time for all of that to happen. But if you're not getting enough rest, a lot of that stuff will not get eliminated. And that's where the senescence thing comes to play. And there's a state of pro-inflammation that's going on because of that. So sleep's important. I think some of this gets underestimated, but a lot of people have sleep problems they don't want to admit to. A lot of people have sleep issues that they don't want to see treated. I don't want to wear a CPAP. I don't want to have this thing done. I don't want that thing done. I don't want to deal with my stress. Stress helps me. I don't want to do this because this is another task that I have to do in order to de-stress. Well, depending on how important it is to you, it won't necessarily make you ill, but it could, because the state of constantly secreting cortisol in your system is a pro-inflammatory state and does not help inflammation. It encourages it.
I think it comes down to we all have kind of balance. Everybody's different.
Yes,
Your body.
absolutely. And you may find a better way to deal with it than I do. Or, everybody has different stressors. Everyone has different sleeping habits. Everyone exercises maybe at different rates, maybe not for as long. I do want to mention too, hydration, because that's a big deal. I kept a couple of books when I took gerontology. I kept a couple of books. One of them was a book on nursing and the elderly. And there was one sentence or paragraph that hit me, pretty, it's like I still remember it. And they were referring to elderly and hydration. There's studies, or this expert within the book said, the elderly are constantly teetering on the edge or the precipice of dehydration, and they just don't know it.
Probably me.
And they're right. And who's to say whether it should be 8 glasses? I think that's a generality. That's in general. But, our ability to detect thirst and our body's response to that also diminishes. When we're younger, it's like, God, the physical response to work, exercise, etc. We're treating that constantly. I know I've seen kids, at schools are constantly at the water fountain. It's like, no, they're not all taking salt pills, but I think when we're younger, we have cues we respond to much easier. But as we get older, some of those cues we don't respond to as well. I want to say by the time, if we're over 65, by the time we see and notice the cracked lips, dry lips, cracked, dry mucous membranes, etc., tongue is dry, thick, you're already way past noticing dehydration. You're well into it. And if you've done nothing about it, that brings on difficulties also. And so I just add that part in. But yeah, I wish there's no magic bullet. I want to say you get in, what I've seen is these individuals in the hospital, they get into a state of hyper inflammatory response. Chronic, some of them have chronic conditions. If you look at the conditions and their background, you're not surprised this is happening. They have a lot of different autoimmune states. They have habits that promote inflammation, not discourage it. And then you look at that, what's going on with them? Why are they in SIRS? Okay, this is a response. Maybe they have a virus or a bacterial infection, but look at look at their background, look at what their body's dealing with day in and day out. It's all a slow burn of inflammation, which is hard to explain if you're, maybe not seeing this. It's a little hard to explain maybe. But, I put these pieces together and I look at this and I think, aha. I look at their laundry list of medical problems and issues, and then what's brought them in here. And how old they are, what's their background. Of course, I can't snoop into other areas like, did you grow up next to a plant that manufactured DDT when you were a kid, something like that. But you do get an idea by looking at what they're dealing with on a daily basis. And so that's where this stuff comes into play. That's where, treating your diabetes, cholesterol, changing your diet, hydrating yourself, exercising. A lot of these are actions that you can take that will. No, it's all right. It's all right. I think I'm at the end. Questions throughout. So, yeah, it's kind of like a slow burn. I had a sort of a slow start to this, and then I don't know what it is, but my brain did not kick into a gear until about halfway through. Isn't that crazy? That happens to me sometimes. It's like my brain is like, oh, okay, let's get out of sludge mode. And all of a sudden now my brain is operating in proper mode.
So the last time Dr. Buka Putnam spoke, she talked about inflammation as well. And she said that if you take turmeric supplements.
Okay, I mentioned that.
Yeah, you can decrease your inflammation. And the second thing I wanted to say that I went to the Gerontological Society
Oh.
of America's program last fall, and the head of the NIH was the feature speaker. And he said they were doing research on an Alzheimer's increased memory medication, right? So they had this big research study. They had the medication they were testing. They had the placebo group, and they had the control group take multiple vitamins just so that everyone was on the same nutritional level. The medication did nothing for the memory. The placebo group, of course, had no increase in memory. The people taking the multiple vitamin, surprisingly, had increase in memory. And so their cognitive ability was increased by just the nutritional factor. So they said, it's astounding. It's astounding.
It's not rocket science, but yeah.
It's-
Well, it's free, yeah. Well, no, that makes sense.
He likes that one. He likes that one, I'm sure.
Yeah,
Okay,
oh,
we're gonna
yeah.
end it.
Yep, let's end it, yes.
Thank you very much.
Yeah, go for it. Yeah,
So I did that. So I jumped into the water. Water. So I started reading about people like if you have a heart condition, you don't need to walk.
yeah, I can lower your heart rate by a big factor. Yes.